Hey, health junkies! It's time for The Health Fix. Join your host, Dr. Jannine Krause, as she gives you a dose of what you need to know and do right now to take control of your health from the inside out, to rebel against aging, look damn good, fight stress, and laugh every day.
Hello there, health junkies. Welcome to another episode of The Health Fix. I'm your host, Dr. Jannine Krause. In today's episode, I have a treat for you. I have Dr. Robert O. He is a buddy of mine from my gym, and we are going to talk all about shoulders and shoulder injuries and preventing shoulder injuries, since it is a common thing that I see in my office, and I think Rob's seeing that a lot too in his office. So without any further ado, Rob, say hello.
Hey, Jannine, thanks for having me on. It's been wonderful to have us here. This is great.
Good deal. So now, Dr. O is, of course, contracted with the government. So we have to have a little disclaimer here really quick before we get going into this podcast. So you're on for your disclaimer.
Okay. The views expressed in this podcast are those of the author and does not reflect the official policy or position of the United States Medical Command, Department of the Army, Department of Defense, or the U.S. government. All right, that's it.
All right, legalities all aside, now let's jump into it. So Rob and I were talking about a gal pal friend of ours who has some shoulder issues, and we've been working together with her because I was working with her on acupuncture and we had her to PT, but she just wasn't getting better. And so I think it's really important to bring up the issue of shoulder issues, because I see so many ladies in my office with frozen shoulder because they started having pain and then things just kind of spiraled out of control from there. And so what I wanted to talk to Rob about is all about, self kind of, looking at with your workouts when you see you've got some stuff going on with your shoulder, what to do. So kind of a little bit of self-diagnosis, not, we got to see the professionals, but, kind of going, what's happening here and what can I do to maybe prevent it from turning into a full-blown issue? So tell me, Rob, a little bit about what you think about when you have patients coming in and they're telling you they've got pain, and you're thinking, okay, can they prevent it, what they can do at home? I know it's like a loaded question of so many different things, so I'll let you kind of start in terms of what you think in terms of shoulder issues, like most common.
In terms of if they come in with shoulder pain or if they're looking to prevent shoulder pain.
Let's go first with looking to prevent shoulder pain, because I think a lot of people are in that category because maybe they have some twinges here and there, but they're not sure where it's coming from.
Yeah, shoulder is a pretty complex joint, and so one of the things about the shoulder joint itself, there's three joints. One of the top called the acromioclavicular, one of the ball and socket type joint, which is the true shoulder joint, and then also the sternoclavicular in the front. So there's a lot of complex things going on in the shoulders, but the most common thing in the shoulder is pain with overhead activity. That's by far the most common thing I see. So with that, a lot of times those tend to be with the rotator cuff. Rotator cuff are small muscles in the shoulder. And with that, most people don't train for the rotator cuff. They don't make any training for that. And so one of the things I do see a lot with rotator cuff injuries or pain is the overhead activity. And probably the most common thing that I see that shows that that they could do to potentially prevent this is most people work their shoulder or their bodies in the front side, but not really on their back. So the back is really just balancing, and the shoulder is the balance of the front muscles and the back muscles. And if you really do want to prevent those, if your patients are in the gym and healthy, they really want to work those back muscles. They call the non-mirror muscles. The mirror muscles are one of the front that people always want to work out, but you really want to work the back muscles, the small little muscles in the back that balance out those shoulders. So if you see your shoulders rounding forward and you have bad posture and you see your back kind of hunched over, I think you may have to think about really looking at how to strengthen those back muscles.
Oh, I think that you're on it with that for sure, because those back muscles, I think a lot of people, they get in, they see the chest presses and stuff when they get in the gym, like, yeah, I can do that, I want to do that, that's tough. But all the simple, smaller, more calculated motions for the back, especially like your posterior deltoid and those guys, a lot of people are like, what? I can only lift 5 pounds and I have to go slow. Ugh, it's rough.
Yeah, absolutely. And all those little back joint itself and includes scapular movement, that the scapula has to really make sure it moves appropriately, and that it's such an important part. The trap, all those things are important in the shoulder, the movement and mobility of the shoulder.
So a lot in my office, I'm kind of sitting ladies down, and I see guys too, and I'm sitting them down and saying, okay, like, what is your mobility? Because a lot of folks will come in and be like, hey, I hear you do CrossFit, I want to do this. And I'm like, whoa, wait a minute. What, have you even worked out ever in your life? Because I do have a lot of folks that have never done anything and never lifted weights, and then they want to jump into something like CrossFit. And I'm going, wait a minute, no, mobility here is important. So I would love to hear you kind of help support me in this statement. Are you, how important do you think mobility is to preventing shoulder injuries?
Yeah, I think mobility can be very important. So like I said, a lot of people work on those pec flies, bench presses, and one thing we've seen a lot is if you have a tight chest muscle, so that's my dog, if you have a tight chest muscle, the pectoral major and minor, that will bring the shoulder and roll it forward because it's so tight. And if that is super tight, then you're not going to get that mobility underneath and overhead activity. So you have to stretch that major and minor muscles to get that mobility going. So that's a really important one, and that's right in the front of your shoulder that inserts into that shoulder right here. So I'll pull that over and turn it over here. So you really want to, some people use lacrosse balls to just get that mobility going. That will help tremendously. A lot of the other things about mobility is lats. So if you have tight lats, that can pull the shoulder down, and that won't be able to fully extend it overhead. That would be another place that would be really tight to work on. So those are two main areas I would focus on for mobility.
Okay. Yeah, that front of that shoulder and that lower lat. So for folks that don't know what a lat is, the muscle that's kind of on the sides of if you look at your armpit, it's kind of on the sides of your armpit coming down and attaches into your back. Those muscles, I find a lot in my practice that in particular the front of the shoulder, just because of posture, people don't even have to be working on chest presses or anything. Just full on poor posture of rolling forward is already a precursor to setting them up for shoulder pain in the front side of their shoulder.
Yeah, no, I agree with you, and I think that's because of our society today where we're always hunched over on our phones or our computers, on our desk, standing or sitting down at our desk. And so whether it's a mobility issue or a weakness, you got to work both.
Yep. No, it makes sense. Now, for the average individual who's maybe using a lacrosse ball in the front of the shoulder, they're using, something to kind of release their lats, and then they're stretching in that case, if they have pain, do you recommend that they go see, would they go see you? Would they go see a functional movement doc, someone who's trained in functional movement to help them with that movement and mobility? Or would you say having them find a PT that's functional movement based? What would be the first step for them if they're struggling to get things released on their own?
Yeah, every place is a little bit different in terms of where you go, and every physician will have a little bit different bent. So your general physician will probably be okay, but I would probably recommend a physical therapist to start off because they are specialized in movements and they specialize in physical activity, and they kind of know the anatomy very well, and they know the shoulder. So I would probably recommend them to go to at first. I'm not sure if Washington State has independent physical therapists where they can just walk in and make an appointment. If not, you would need a referral from your physician.
Yep. And that's usually what I do in my office. I'm usually first thing first is the movement based. Now, hey, have you heard anything about the Arasti group in terms of their special training for working with shoulders?
I've heard of the Arasti, and I know a lot of CrossFitters do Arasti. I just don't know exactly what they do differently. So I have not really engaged Arasti.
Okay.
Considering, I do have a sports medicine background. The other thing I've also seen a lot of people do is range of motion and mobility walk from Kelly Starlett's groups, which is really a combination of yoga plus CrossFit, really. So, and that's probably good. But one of the things I do want to tell your audience is sometimes you have mechanical issues, especially if you're older, if you have osteoarthritis or arthritis in your shoulder. If you're really having pain, you should try not to move through that pain unless you know there's no mechanical defect, right? So there's a mechanical impingement. There may be bones, spurs that really may cause problems, or people have just different anatomy types, right? There, acromion maybe, which is a part of the shoulder joint, may have a really sloping, will put them at risk for impingement already. So if you're having some unusual pain, you really do need to see a doctor.
I absolutely agree. I think a lot of people will come into me and they'll be like, I want an X-ray and I want an MRI, like today.
Yeah,
and I'm I wish that I could do it that way.
Not the first step. Yeah.
No, I know. Going through a lot of the physical exams with people, sometimes I think it's, for me, I mean, I'm not a sports medicine based doc, so I know, the basics, but I feel like sometimes I even am not 100% sure, like, was that positive? Was it not? I would love to hear your opinion in terms of reliability of the shoulder tests, because you sent me over a great article on that.
Yeah, the shoulder exams are not very good. That's why we have a gazillion of them, with a gazillion eponyms that we don't even know what the benefits are. So you have to combine your clinical expertise with the exam findings together. Without those two, it's kind of meaningless. And that's why you can put a couple of orthopedic surgeons, sports medicine physicians together, and they may come up with 2 or 3 different diagnoses. So that's where the clinical expertise has to come in, and the exam findings, you have to put it all in context. And you have to put it in context of the individual. What do they do? What movements bother them? What are the most likely things that would happen? And then it's really a probability test, right? So it's more likely he or she will have this because of this exam and the clinical finding. So they're not reliable. And if you do find something that's positive, you might find some other test that will completely negate that positivity of that test. So,
yeah, that's the trouble I have in the office. I'm just like, oh man, I don't know now what to do about this. And I'm pretty pokey, so I'm feeling on tendons, I'm feeling on ligaments, joints, and going like, okay, what do I feel? Because that usually tends to give me more of a sense of, is something right, is something wrong?
And the problem with the shoulder is there's a lot of referred pain too. Mm-hmm. So if you have pain on the outside of your shoulder near your deltoid, it's usually not your deltoid, which is crazy, right? I've never seen a deltoid injury, never say never, but very rare to see a deltoid injury, but more commonly a rotator cuff. But you can also have shoulder pain that's coming from your neck. So if you have a neck impingement or a neck disc that ruptures, that can cause shoulder pain. But it's not your shoulder, it's your neck.
Mm-hmm. What other ones, besides the deltoid area, that's the rotator cuff and neck, are there any other ones, like maybe behind the shoulder, that you might have some?
Yeah, so if you have behind the shoulder pain, even though you have maybe a tender point there, I've seen that as a neck issue where you have a disc that's ruptured pushing on a nerve that's irritating a nerve and causing that to cause the back shoulder pain. So, neck is an issue. And then you can have a very rare thing called thoracic outlet syndrome. Overlays some of the nerves and muscles, and therefore it pinches off them, especially when you work them out too much. So thoracic outlet syndrome is something that I see in some CrossFit athletes too, or any athletes who do a lot of pectoral muscle workouts and lat muscle workouts.
Okay.
So, yeah, and that's a mechanical issue that gets fixed by mobility. Very interesting, right? So, yeah, there's lots of things. You just have to keep all those in the mind when we talk about shoulder, and it's not just all rotator cuff. And that's the fallacy I think people bring it to the table, is just rotator cuff.
Oh,
yeah, maybe not. Yeah.
Yeah, I think probably 9 times out of 10, I've got someone that'll come in and they'll be like, I think my rotator cuff is torn and I want an MRI right now. And you're like, okay, let's back up for a minute.
Yeah.
You know, and, you know, yeah, 9 times out of 10 it's not. And a lot of times I see the shoulder, like the different styles of acromion being quite a big issue combined with poor posture. And, you know, helping folks to kind of deal with that seems to be a great way to work with it. What do you typically do with folks that have the different styles of more impinged type of slip forward?
Yeah, it's just understanding that if they do have that, they're more at risk for rotator cuff pain and injury. And so what I really have them do is focus on those back muscles to pull that shoulder back, and focus on what we call external rotators, which is moving the shoulder outside with the arm. And if you can focus on the external rotators and the scapula movements, all of the back movements, little muscles in the back, that'll pull the shoulder back a little bit and hopefully give you a little bit more room under the acromion. And if that fails and that doesn't work and they're still doing it, they still need to do a lot of overhead stuff. Remember, it's all functional. Maybe they have to move things overhead all the time without pain. Then that's where you might have to consider surgery.
Okay. What is your go-to like exercise prescription for the back shoulder muscles? What kind of things do you have people doing, and what kind of resources will you send them to you know, besides a physical therapist or whatnot? You know, if you're given the prescription, what do you use? What do you do?
Yeah, that's one thing I love about CrossFit is that if you stick with the CrossFit prescription of constantly varied functional movements performed at high intensity. Let's take away the high intensity piece because people get really wrapped around their axles about that. But let's think about the constantly varied. If you're focusing just on chest flies and pecs and running, you're going to build those muscles and build those endurance. So with CrossFit, if you're doing rowing machine, when that last pull of the row, that is purely all about scapular movement and pushing those rhomboids together. That's a great exercise for that posterior part of the shoulders. I actually tell my patients to do rows. You can do the chain rows, and in 3 different positions. At the low row position, which is towards the hips area, and once that feels a little bit better and without any pain, then I have them do a mid row towards the chest area. And if that's causing no pain, then start working on the high rows towards your chin area to start pulling that. And they can use bands, they can use TRX ropes, they can use their body weight, they can use a lot of anything to get that row and to push those scapula blades together. And that's exactly what muscles you want to work on. And that will pull those shoulders back and build those muscles. And I got to say, pull-ups are also a great workout for those back muscles. The lat muscles will definitely start working and pulling those shoulders and the traps and all those things. But again, you have to have some strength. So you can do lat pull-downs. You can work on those as if there's no pain overhead. And the other workout is the intrinsic muscles of the rotator cuff is to really move that shoulder out this way. Mm-hmm. So that's kind of the concept that I want them to do. But focusing on the rows, and people really understand rows really easily. Low rows, mid rows, high rows, and that's pretty basic stuff.
Yeah, it's not too complicated, and it's more fun than the traditional, because I think a lot of people think when they're going to be working on some of the smaller movements, they think they're going to be using those bands that they were given at PT, you know, just the little, you know, all of that, which I think is, some of it has some really good merit, but I think for a lot of people, at least that I see, they're like, no, I want to jump in, I want to do this, and so I'm like, okay, yeah, rows would be a great idea.
I think for your people who have some capacity and physical activity already, and they've progressed beyond the little bands. The little bands are great for the intrinsic muscles of the rotator cuff because most people just don't isolate those muscles very well, right? Especially if you have a shoulder injury, that's good to work on.
Sure. No, that makes sense.
The posterior. You definitely want them to use more of the posterior muscles, and rowing is great, and those cables are excellent. And I would tell them slow weights, 5 to 10 pounds, until they get muscular endurance, and then add weight as long as they have good form to keep the elbows close to their bodies as possible to really start isolating those shoulders. They don't want to use any deltoids, and that kind of really goes against trying to isolate those back muscles. But as they get progressively stronger, as they go to the high rows, you use a little bit of deltoids, but you really want to pull back as much as possible to get that full extension of the shoulders.
That makes sense. Yeah, that I think is where, a lot of people are struggling. And in my office, I don't have a row machine. I'm thinking I need something to be able to do more of a demo of it. Do you have that in your office? Do you get to do that with people?
Yeah, you could do it with a band. So same concept. Just tie a band around a doorknob and demonstrate the movements really easily. So we have bands in our office. I have a rowing machine in my office, but we have bands, and so we just tie it to the doorknob and just demonstrate. And most people understand that, and we have pictures and then they can show to do that. So that's easy. And then they can use the rowing machines at home or their gym or wherever, or the cables if they have it, or you can use the bands, and those are okay.
Sure. No, that's good. Yeah, I think that's important. No, going beyond the analysis of the shoulder, because I know you're into food as medicine too, like me.
Yeah, absolutely.
I tend to think a lot about, what people are doing with their diet that sabotage, joints and sabotage, how their mobility works, because I'm sure you've probably felt the skin and muscles of somebody who's diabetic compared to somebody who is not diabetic, and you can feel how crunchy and just restricted that tissue feels in general. But in terms of someone who's not getting enough good fats, who's not getting enough, protein, etc., what would you say in terms of those folks? What's recording this? Here we are. I had a little bit of a computer issue, so nevertheless, here we are back recording again with Rob O. And we were talking while we were trying to figure out our technical issues here about, just in general, working with CrossFit and health with CrossFit. And I think Rob said you've been doing CrossFit for 11 years and haven't been injured, correct?
That's correct, yes.
So what is the secret? What is the secret? I think a lot of people, think of CrossFit and they're like, oh my gosh, all I think of is people getting injured. What is the secret to not getting injured?
Well, I think knowing your body and knowing when to push and knowing when to slow down is probably the most important. And people get injured doing anything. Like, the last injury that I got where I had difficulty doing CrossFit movements was playing flag football. And so when you're not doing things that you're not accustomed to very often, and you catch something wrong or do something, you could potentially get injured. So that's in life. So it's a little bit of luck plus a lot of knowing your body. So that's my two main advice. Check your ego at the door, know your body, and then there's a lot of luck, right? Because you could trip over something and get injured. And that doesn't mean CrossFit caused it, because you tripped over something.
Yep. No, that is true, because I tend to be clumsy, and those would be my injuries. Like I had said, my handstand injury was me coming down and smashing my toes, but it was because my calves were too tight in terms of why I really sprained that ankle. Now, I think one of the things that a lot of people lack right now in society is that mind-muscle connection, being able to feel their muscles and know when something doesn't feel right and when not to push. As a doctor, I would love your personal opinion on mind and muscle connection and when to not push things.
Yeah, so I think that's a hard one. Sometimes, when we think about, I just retook my level 1 certificate at CrossFit and really enjoyed relearning the whole concept of mechanics, consistency, and intensity. And the concept of mechanics, consistency, and intensity is so important. You have to have the right mechanics. So you have to have pretty good mechanics before you dial in any times of intensity. And then consistency, you have to be consistent in those movements when you're doing those mechanics, right? You can't just do one air squat and feel like you're awesome at it, and then the next 10 of them is like terrible with your knees buckling. And you have to have consistency of that movement. And then finally, I think once that has done, you have to understand when to push yourself, and that's the whole mindset issue. And I think if we understand, okay, I'm not breathing that hard, but I want a better workout, you might want to push yourself as long as your consistency and mechanics are well, because you don't know what life is going to throw at you. And so sometimes if you're getting chased by a bear, you're not going to slow down. And so you have to understand that time you may have to push yourself. But maybe when you're training, it's not appropriate to push yourself if you're not good at that movements. So I'm not sure if that made any sense to you, your listeners, but it's all about training a threshold, right? How much do you want to push yourself, and why are you pushing yourself, and what are your goals? And so you have to understand what your goals are. To give me a practical example, if I'm just doing training, just doing a regular workout, and I don't feel my best, maybe I didn't get enough sleep, and there's a workout that really has its AMRAP of 20 minutes of lots of high-intensity barbell movements, like thrusters and pull-ups, right, like Fran. So am I going to push myself that day to get a PR? Probably not, because I'm not ready for it, and I know my body's not ready for it. And so that's when I wouldn't push myself. Now, if I got a lot of rest, I feel really good, and I'm going into maybe the open workout, and I really want to do well in my open workout, and I really want to push myself to see if I can break my PR, and I feel good. Am I going to push myself with Fran? Yes. And so I think those are the times when you can push yourself, because you won't know that you're going to get a PR unless you try to get a PR. And so you can't do it unless you know that you're going to try to fail. And CrossFit talks about that as you only fail at the margins of your experience. But if you always stay in your safe zone, you will never see what your body can do, or potentially what your body can do next. And I think that's the whole intensity part that people don't understand.
Yeah, I would agree. I think that's a learned type of behavior for sure in that case. So thank you for saying, what you had to say there, because I think it's important for folks to just hear that we can push ourselves. And I think the take-home message is, as long as you've got some good form, and if there's a goal like a CrossFit Open competition or something like that, that's a whole different story. But as long as you have good form, you can push yourself, and you can, see what your body can do. Now, before I had my technical difficulties with my computer here, we were also talking about nutrition and food to fuel your body, but also to keep your joints and tendons and ligaments healthy. And I saw one of your podcast posts on fish oil, and I know that you've got a bunch of other posts on food and whatnot. I would love to hear your opinion on what sorts of fuel our joints need, and what you recommend to folks who have joint pain, or who have pain in general, or who are just trying to prevent it.
Yeah, big thing is eat real food, and that's to me the number one step. I think people eat a lot of processed stuff, people eat a lot of junk food, and then they try to supplement their way out of that badness, right? And so you get people eating chips and Doritos and other junk food, and then try to do some omega-3s and glucosamine for their joints. I'm like, that doesn't make any sense. So you have to start with real food and start with clean foods, things that are not processed. That's, to me, the base. And if you can do that, you're going to solve a lot of issues on food itself. The other thing that I think people miss is, even with that real food, is the omega-3s. It's really hard to get omega-3s in abundance. And I think our processed food society pushes a lot of inflammatory fats, including the omega-6s, and that's a lot of the industrialized processed vegetable oils. And vegetable oils are in everything. So if you can decrease your intake of those inflammatory omega-6 and then increase your intake of the good omega-3s, you can do it. And in the Pacific Northwest, salmon is abundant in omega-3s. So I would say enjoy your salmon.
Eat as much salmon as possible out there, folks. No, I agree.
Yeah,
I agree.
especially the wild salmon. And then if they do have problems, then I would do, if they wanted to, do some supplementation with omega-3s. I'm okay with that, but I really try to focus them to decrease that omega-6 to omega-3 ratio. Just try to make sure they don't like gorge on French fries with all the processed oils, and then they try to then supplement themselves out of it.
Yeah, I think that's a really good point that you're making there, because I feel like that's what people do all too often. And then they're like, the omegas aren't working. Like, no, it's not that the omegas aren't working. It's that you are countering them. Basically, you're making them, you're wasting your expensive, supplements. Those are expensive, and you're wasting your time on those. Tell me this. What is your opinion of collagen powders and like glucosamine, chondroitin, bromelain, all those different things, the turmerics for helping? Have you seen them to be effective in your case?
I do look at the literature a lot on the glucosamine and chondroitin, and I got to say they're all mixed. Some say it works, some say it doesn't. And if you look at some good analyses where they put all those studies together, most of it says it's not helpful for joints. However, and that being said, for individuals, you just may never know. And so if they're having some joint pain, if they have osteoarthritis in the knees per se, and they've tried all those other medications and they don't want to do any surgeries or get a knee, then I do recommend give it a try, and it won't hurt them if it helps, if that makes sense. So I do recommend it if they try it. Similar to, there are also some interesting studies on turmeric, and turmeric 500 milligrams 3 times a day has been shown in some studies to be effective in osteoarthritis. So that may be useful if they're doing everything else to help with their pain, that they may also help with a little turmeric.
Let's talk about turmeric for a second, because that's one that I use commonly in my office at the 1,500 milligrams a day dosage. Yeah. I like the liposomal delivery ones versus like the desiccated BCM 95, which they say is the most absorbable when it's not a liposomal. And then there's the ones combined with pepper. Have you experimented with the 3 different types and seen difference between those with your patients?
No, I don't know the specific details on those types of deliveries, and I would really rely on your expertise to tell patients what to get. But I just look at the studies and try to figure out what the dosage is and what form that they use that had that effect. So whatever, to me, the best study out there, whatever form that used, I would recommend that to my patients if they had more details. So I would have to look up the article, and then I can get back to your listeners about what specific versions that they used for that delivery system.
Makes sense. What is your opinion on antioxidants? And I'm not talking about taking supplemental antioxidants. I'm talking about having, veggies during the day, fruits during the day. And what is your recommendation to patients? How many cups of fruits or veggies a day? What do you usually say?
Yeah, I say veggies are free food. So you can eat as much as you want, and there's probably no harm of eating a vegetable. You got to be careful what type of vegetables. If they have some metabolic issues, that includes diabetes, even if they're overweight, and a lot of people are overweight in our society, and they have any evidence of insulin resistance, you have to be careful of what I call below the ground vegetables. The higher starch vegetables, potatoes, even some onions, rutabaga, all those root type vegetables, if they have a lot of it, that they can provide a lot of carbs, and the carbs can drive insulin, and insulin can drive fat. So I try to tell them, hey, anything that grows above the ground, you can eat as much as you want. I don't really care. And if you want to have carrots, that's fine. But other than that, if you have some sort of metabolic derangement, I would say, hey, let's cut those out as much as we can. And those are free foods, and the below the ground vegetables are not free foods.
All right, that's good to know. And that makes sense for a lot of folks. In terms of the beets, because beets are getting all of this press now in terms of being these nitric oxide
nitric
boosters.
oxide and everything. Yeah, absolutely.
What is your opinion on the beets? Since they grow below the ground, would they be in the same category as carrots?
Yeah, I think if you are a high-level athlete and need that extra performance boost, nitric oxide has been shown to help a little bit with performance. But I got to say, most people are not, right? Most are not high-level elite athletes. And I said, okay, if you're using beets because you love it, and great, add that into your diet. Don't gorge on beets like anything else. But if you're trying to add performance boost, let's look at other factors to see, are you overweight at all? Do we need to look at other things besides a nitric oxide boost? So I think people get overwhelmed with trying to figure out what's better for their performance, but rather than looking at their overall health. And if they focus on their health, if they're just eating beets to get a performance boost and they're overweight, I'd probably shy them away from doing that.
Yes, that's a good point. Because yeah, you bring up a really good point. People do tend to jump off of like the basics and go straight for high performance athlete stuff, like the recovery and the pre workout and all those different things. And I don't use any of them.
Yeah.
I don't know if you do, but I don't. I do use the protein powder, the what stuff we have at the gym, Stronger, Faster, Healthier. But I don't use any pre or post workout.
I think the proteins are fine. I mean, most people do not get enough protein throughout the day to build muscle. And if you are really trying to build muscle and get some gains, that's fine. But people don't realize that if they're overweight, those gains are not going to help. Those gains are actually going to probably you're going to probably feed more fat, right? So you got to get to a lean body mass that supports exercise first, and then once you get to that, then you can add in some protein to get that lean muscle mass. So I think people try to gain lean muscle mass without losing fat, but probably the better way is lose fat to gain lean muscle mass.
That's a great thing that you mentioned, because I think you're absolutely right. I think that we're stuck in a society where it's like, oh, well, let's load up all the protein and do the ketosis stuff. But wait a minute, where's the weight loss first before we start eating copious amounts of bacon and butter?
Yeah, I think you have to get healthy. And I think, Ben Bergeron, he's a real awesome coach over at CrossFit New England. I listen to his podcast a lot called Chasing Excellence. And shout out to him. And he basically does not push his athletes to do these supplements unless they get towards a body fat percentage that would help them get better. So you can get a lot better performance by losing 5 to 10 pounds, right? And then working on some of the isolation just by muscle strength before supplementing anything. So he really pushes people to get to 15 to 18% body fat for women and 10 to 15% for men before they start pushing the protein supplementation, which completely makes sense.
Right. I like that. I agree. I know we're getting short on time and you've got to be headed on to church this morning. So I would love to have you back on and talk more about other injuries in different areas of the body and kind of talking through mobility and whatnot. So we're definitely going to have to do that. But
yeah, that sounds fun.
Before we sign off, I do want to have everybody directed over to your blog, because you've got some great articles and some really great information there. So why don't you tell us all how we find you online and where to find your blog and all of that different details so that they have all that information.
Yeah, all they have to do is robert.oh and Google that plus WordPress, and that should be my blog. So that should be easy to find. And I'm not prolific on my blog, so I do more tweets than blogs, but then you can follow me on Twitter at RobertOMD, Twitter.
That's awesome that you do tweets, because I'm terrible at it. Ugh. But that's good because
Yeah,
real time info.
yeah, the micro blogs, and it's a lot easier to digest the micro blogs and the longer blogs.
Oh my gosh, yeah, I try to do my public service announcements on my tweets, but it's hard. So, oh my goodness, I give you props for being able to do that. So I am thinking we definitely do another round. We'll come up with something as we see each other at the gym, most likely tomorrow morning anyway, and we'll go from there. So thank you everybody for
Sounds good.
tuning in to the Health Fix. I'm your host, Dr. Jannine Krause, with Dr. Robert O on today. We hope that you've enjoyed and learned a couple things from us, and we will continue this conversation in a couple more podcasts. All right, everybody, have a great day, whatever you're doing. Hey everybody, Dr. Jannine Krause here. If you liked what you heard today, then head over to drjkrauseND.com to find my free resources and information to know when I post something new that's juicy that you might want to check out. Plus, head over to where you get your podcasts and subscribe, and write a review to help get the word out about me and help others at the same time to find me. It really does help, and I really appreciate all of your reviews.